The inferior mediastinum lies below the imaginary line drawn from the angle fluis to the lower border of the fourth thoracic vertebra. It's divided by the heart and the pericardium into an anterior mediastinum anterior to the heart, between the heart and the anterior chest wall, a middle mediastinum containing the heart and the pericardium, and a posterior mediastinum posterior to the heart. The anterior mediastinum contains the thymus, and it's very difficult to demonstrate the thymus in an adult, so this will not be dealt with anymore. The middle mediastinum, which is the heart and the pericardium, will be discussed in the next practical session. And today we will discuss the posterior mediastinum. Here we can see the esophagus descending downward from the superior mediastinum to be in the inferior mediastinum. In the superior mediastinum, it was the most posterior structure, and here it lies just behind the heart and the pericardium. The esophagus is accompanied by the two vagi, one anterior to it, which is the left one, and the other one lying posterior to it, which is the right one. If we track the esophagus, we will find the esophageal hiatus of the diaphragm, which lies here at the level of the 10th thoracic vertebra. So here is the esophagus, here is the right vagus nerve, and here is the left vagus nerve. Behind the esophagus is the descending thoracic aorta, which is found to be tucking itself between the esophagus and the thoracic vertebrae. The descending thoracic aorta enters the diaphragm at the level of the 12th thoracic vertebra. To the right of the aorta and behind the esophagus is this lymphatic duct, which is known as the thoracic duct. This is the longest lymphatic duct in the body, and lateral to the thoracic duct is the azygous vein. Here we can see the intercostal veins entering the posterior intercostal veins entering the azygous vein, and the posterior intercostal arteries getting out of the descending thoracic aorta. So here are the veins, and here are the posterior intercostal arteries. The duct lies between the azygous vein and the aorta. Here we can see this chain, which is the sympathetic chain, and here we can see the intercostal nerves related to this sympathetic chain.